Not right now.
Okay, we'll wait a couple minutes. I think we got about 24 people live right now. Thank you guys for logging in. We're gonna wait till a couple more folks get in. We just went live a couple seconds ago, so it's gonna take a little bit to get more and more people on board. Barbara Reyes, good to see you, Barbara. Cynthia Lissette, how are you, Cynthia? Thank you for logging in. We're about to start. Didi, hi. Thank you for logging in. Eva, how are you? Good to see you. I think we're going to go ahead and start. Welcome, Miami Lakers. Thank you for joining us today for our COVID-19 update here in our community. Just a reminder, we have a council meeting tomorrow due to social distancing requirements, and obviously because we have a large room and we want as many folks to attend. We're still going to be doing our meetings via Zoom following the county's order. So we will be live tomorrow at 6:30 via Zoom. But thank you guys for logging in, and I'm joined by our deputy town manager, Tony Lopez, who has some important details for you all. I know we saw last week, and we're seeing the cases really increasing. I know just a couple of days ago, I think we had a record amount, not only of cases, but a record amount of people that got tested. I think the test results were close to 140-something thousand people just one day were released. I think that's one of the largest numbers, so I know, which is good. We want to see more and more people get tested overall. We want to see that infection rate go down as much as possible. We want to make sure that as many people as possible are safe and are doing well. So, Tony?
Hello, Miami Lakers. I just have a brief update regarding the coronavirus I'd like to share with you today. We've had a total of 365 cases to date. Since our last report on Thursday, that is an increase of 7. Like the mayor mentioned, this increase is consistent with the level of testing and is an increase of cases that we're seeing across Miami-Dade and Florida as a whole. There are no additional changes to any of the emergency orders that are currently in effect. As a reminder, please continue taking necessary precautions such as wearing a mask, practicing social distancing, and following the rules and guidance provided by federal, state, and local agencies. Only by us taking these steps together as a community can we help stop the continued spread of the virus. Also, if you don't have to go out, remember that you're always safer at home. Hola Miami Lakers, solo tengo un breve reporte sobre el coronavirus que me gustaría compartir con ustedes hoy. Hemos tenido un total de 365 casos hasta esta fecha. Desde nuestro último informe del jueves, se trata de un aumento de 73 casos nuevos. Este aumento es consistente con el aumento de casos dentro de Miami-Dade y la Florida. No hay cambios adicionales en ninguna de las órdenes de emergencia vigentes. Como recuerdo, continúe tomando las precauciones necesarias, como usar una máscara, practicar el distanciamiento social y seguir las reglas y los avisos por las agencias federales, estatales y locales. Solo tomando estos pasos juntos, como comunidad podemos ayudar a detener la propagación continua del virus. Además, si no tiene que salir, recuérdese que estás más seguro en la casa.
Thank you, Tony. Miami Lakers, start submitting your questions. We're live on Facebook, YouTube, and Twitter. So empieza mandando su pregunta, que estamos en vivo en Facebook, YouTube, y Twitter. I just wanted to share with you all some of the hospital data. So the county just released their dashboard just a bit ago, and we definitely got to keep looking at these numbers. Based on today is the 13th. Based on the stats, 236 new COVID patients have been admitted to our local hospitals here in Dade County. 137 COVID patients have been discharged. That was today. Yesterday, the same thing, 189 new COVID patients, 168 were discharged. The day before, 179 new COVID patients, 221 discharged from the hospital. So it's always important to see more and more folks get healthy. We do have 400 COVID patients in ICU beds currently, 413 here in Dade County. COVID patients on ventilators here in Dade County, 215 COVID patients here in Dade County. So, I think what these stats tell us is the reality that keep wearing masks, keep washing your hands, keep following CDC guidelines, and keep doing the right thing. So, I look at those stats, and that's the one glaring thing that it tells me. We have to just keep wearing our masks. A lot of times we get comfortable because we might have some friends, we might go off to party or whatnot, in our home, but I think that's something that's shown, if it was the protests, it was the big parties at home, it was whatever it may be. The main thing is, whatever you do, just wear your mask, especially with non-family members. If you're hanging out with folks that aren't your family members, just make sure you wear your mask. You don't want to infect somebody. We do know, fortunately, that the vast majority of people in our society are going to be okay. But unfortunately, if that virus were to get somebody, for example, like my dad has Parkinson's and he is very vulnerable, so he's in deep quarantine. So that's me myself. I haven't been able to hug him, because I know that I'm exposed 24/7 all over in our community because I'm going around everywhere. So, but the main thing is to wear your mask and make sure that you don't get near people who are most vulnerable in our society. We do know that a lot of the COVID deaths that happened in the U.S. were living in long-term care facilities. Now, due to that, they're in lockdown. Fortunately, so we're protecting our most vulnerable. Do we have any questions, Clarissa?
We have a few questions on the total number of cases in Miami Lakes.
The total number of cases in Miami Lakes today, that means this number is going to include not people today, not COVID cases today, but the total number from the beginning of the pandemic in March. 365 cases here in our community. That's 365. There aren't 365 people today. We do know from March, April, May, June, now July, that is the total number. Look, the reality is that we already know that number countywide is a lot larger because there are a lot of people who had the antibody. When we did the antibody testing here in our community, it was 3% of everybody that took the antibody test, that donated blood, were positive for the antibody. The county's antibody test was a bit larger, and their percentage came back. So 7% of the entire county is close to 200,000 people. 7% here in our community is a lot of folks. I think like about 1,800 people here in the town of Miami Lakes. So those are big numbers, and we do know that more and more folks are asymptomatic. They don't even know that they have it, and now they have the antibody. So these are the numbers that we have are people that have probably had symptoms, have gotten tested, and now they're part of that count. But that count is all the way on till today. So it's so important to keep that in context. Anything else, Clarissa?
No.
So no other questions. I'm gonna see any stats here that came out today to showcase. Anything else you wanted to add, Tony, in the meantime?
Well, just to briefly add again, stressing the current regulations and restrictions that are in effect, the quicker that we all can work together to ensure that we can get our numbers down, hopefully that means that we can go back to returning to the phase that we were in which we have restaurants open, businesses with less restrictions to be able to operate and to be able to serve the community in a new normal way. But again, the quicker we can bring these numbers down, and it's an effort that we can do hopefully together, the quicker we can get to resuming a new normal.
I do know, I read somewhere today that they're hiring, the Department of Health is hiring contact tracers. So if you are out of a job right now, not only is the census hiring, but I do know that the health department is looking for contact tracers. We know how important that is. How, as a public policymaker, how can you make decisions on what to close, what to open without data? And that, I think the contact tracers is going to showcase where people got, where they were exposed, who they got it from, you know, and going all the way back. And I think that's so important to making sure that it doesn't continue to stop. You know that there are two good paying jobs out there, being a contact tracer or the census, that are continuously hiring, and they need more people. So make sure that you check out those websites on Florida's site and on the census site, and get all that information and apply if you do need a job at this moment. Clarissa, anything else?
Yes, we have Marcia Traviano. She wants to know if there are any COVID-related deaths in Miami Lakes.
COVID-related deaths in Miami Lakes, Tom.
To our knowledge, we only have the numbers that are provided to us from the state, which talk about it in a county level. We can certainly see how much we can get that number distilled, and certainly get back with that information for our next update, if it's available. But for now, what we do have is what the state's reporting and the county's reporting.
Yeah, I think we're over 1,000 COVID deaths here in Miami-Dade County. Make sure that we keep all those families in our prayers. You can only imagine the difficult time they're going through. But yeah, there is information that we don't get directly. We do get the global picture of what our communities looks like, but we don't get that type of detail in terms of what's going on with the infection. But like I showcased earlier, it's a tough look in terms of the amount of people that are getting admitted, but the good part is, and I'll share that again, that there are a lot of folks also being discharged, which is so important. Just on the 11th, for example, 179 new COVID patients in Miami-Dade County hospitals, 221 discharged. I mean, so it is, yes, there are people that need treatment, might be having issues, but fortunately there are a lot of people being discharged. But we definitely have to keep doing more in terms of wearing our masks. I'll tell you this, the one thing that I have noticed, Tony, and maybe you've noticed it too, is there's more and more people wearing their masks. Yeah, you might have your outliers, a couple folks that don't, but the amount of people taking this serious today, and again, regardless of affiliation, regardless of philosophy, regardless of, whatever it may be, but the amount of people taking this serious, I'm seeing it every day. There are more and more people wearing, again, there might be your outliers out there that might not be following the rules, doing whatever they need to do, but they are taking it very serious. The other thing I'll tell you, I believe, I read this earlier, I'm going to see if I can find it right now, where the county mayor announced that he shut down a business yesterday that wasn't following the rules, and the owner got criminal charges. So forget about a civil fine. What we're starting to see is the county mayor has taken that step we see exactly, the county mayor has taken that step to, look, it says it here, that business operator, the county mayor I talked about earlier, business operator was charged criminally yesterday for ignoring COVID rules. Think about how serious that is. There's an emergency order in the county level. A lot of people initially, we saw it. I mean, there were nightclubs that were open. There were people having huge parties, not doing the right thing. Some of those folks were getting shut down for a day. They were required to come up with plans to reopen. They would reopen. They would get civil fines, right? Some people didn't take it serious. The county mayor has taken it to a point where people, business owners, business operators that aren't following the rules are getting charged criminally. It's a big, big deal. I don't think we've seen that in a long time, where the county's taking such a strict position, not just fining people. A lot of people don't care about civil fines, right? They get a civil fine, it's, yeah, we'll deal with it, we'll pay it. I think a criminal charge, especially in these times, is something that's very, very serious. So to see that, it's going to be definitely very, very interesting seeing how people need to comply with the rules. And you saw it yesterday. There was somebody got charged criminally because of it. Anything else on YouTube, Twitter, Facebook, Clarissa?
We have a question from John Cuartas, and he wants to understand what the main goal of this stage is compared to the phased-in approach that occurred 2 months ago.
So this stage that we're in right now is specifically targeted two types of businesses, right? Restaurants and gymnasiums. There are some others like movie theaters that weren't operating.
And they have restrictions to comply. That they have to bring it to compliance to be able to operate.
So you want to talk about those two areas, what the major differences are, and I'll delve into it afterwards.
Yeah, and mainly this came from the county mayor's office that stressed that there were two places in which you really had to. One of those was restaurants. So you would, in essence, come into a restaurant indoor space, and it was one of the few indoor spaces where you can take your mask off. Gymnasiums were the other business in which you were in an indoor space with other people and were able to take your mask off. So that's why some of these restrictions on gyms have been changed, in which masks are now required to be used, a heightened level of social distancing, for example, and restaurants have now, they've closed the indoor dining spaces and moved them outdoor.
So, and that's one of the main things. And just remember, there are areas where government can't shut down certain things, right? If somebody's having a party in their home with 50 people, government can't shut that down, right? And that is something to remember. We have to take personal responsibilities. Our rights are definitely protected, but we have to take personal responsibilities when it comes to that. There are a lot of folks who are having huge parties in their homes, bringing in people from all walks of life, not knowing who they're in contact with, and then that's causing that too. I know there are a lot of folks that talked about even the protests and counter-protests and this and that, and people in large groups, you know, and one thing that the county mayor had said, and some of the county experts, is that when folks don't have their mask on and you're singing or you're yelling, that the transmission rate increases exponentially. I mean, that's one of the reasons why even now in this new move that he made, he talks about outdoor seating and having the music outdoors at a certain decibel level, so to make sure that infection rate, just say you hear a song that you like and you want to sing to it or whatever, they're saying that if you don't have your mask on, that there are more chances to have the droplets fly and infect somebody else if you were to have it, or if somebody else would have it. So, and here's the one thing I do definitely tell everybody, because it's so important. I was on a town hall, a virtual town hall the other day, a medical expert on there who was saying things that were completely contrary to what some of the folks at FIU were telling the county mayor, at UM were telling the county mayor. And that's my realization too, where even the experts even the epidemiologists, or the infectious disease experts. The information that they're receiving from the CDC, from people working in labs, the scientists, is changing every single day. The World Health Organization, other groups like that, their information changes every single day. The reason why? It's because it's a novel virus. Nobody has seen this. Nobody's had time to see this. We know it takes a long time to prepare proper vaccines or whatnot for these types of things. So that's why there hasn't been enough studies on this. So that's why the information changes every single day, really. And it's, for a policymaker, in our shoes, in our perspective, it's frustrating because you're constantly, you're running behind the game, because at first was, hey, you got to shut down everything because surfaces were highly contagious, and then that information changed. Oh, hey, we got to be careful because asymptomatic people are super spreaders, and then that information changed. So those are the things as policymakers that once we gear our policies towards that information we're getting, it changes every day. So it's
only been a 4-month period.
And Tony's absolutely right. Here in the U.S., it's been a very short period of time, 4 months. So you could only imagine. I know what happened in China and in Europe and Italy and stuff. I'm sure that they're still working with some of that information. But our experts here have only been dealing with it for 4 months. So,
which is a very short time frame, considering the span and scope of what we're facing, medical sciences and technology. So those are some of the challenges we're facing.
So yeah, any other questions that we got on there? Or?
We have a question from Lynn Matos. If people test multiple times and are positive each time, by person or number of times tested?
So it was interesting. The other day that discussion was happening on the state and county level. Supposedly the county and the state were counting different, right? I mean, their percentages were completely different. I don't know if they fixed it. I don't know if you've heard more
I
about
have
that.
not, but that's why there's a critical distinction in the data to know. You have a total number of cases, positive cases, and then you also have a positivity rate, which is a positivity rate of new cases. So both of those data points are ones to take note of. And in terms of getting any more information on double counting and things like that, those are things that we're still awaiting a formal confirmation on. But make sure to note that there's two separate data points, which is positivity rate, which counts new cases, and then there's this total positive case count, which there's a possibility that there may be additional cases counted.
Yeah, like that. Look, I'll give you guys an example. Last week, there was a statewide reporter that had tweeted out that the state had Miami-Dade positive rate at 20.2. This is 3 days ago. But the county was saying that it was at 33.5. Some people believe that the county at that point was counting all positives, while the state only was counting. That is, we got to make sure we get that information right, and that's Twitter. That was Brian Enton that had tweeted that out. He was a reporter for Channel 7, an investigative reporter. So I saw that and I had shared it with staff, because to me it was eye-opening, right? Where you see that, because going from 20% to 33, I mean that's a big difference. So we want to make sure that information goes, because we do know that there are people that test positive multiple times, and until they don't test negative twice, they don't get kind of the green light to go back to work and do whatever they had to do. So, but yeah, that's Clarissa, anything else?
We have a question from Christian Ramirez. If an enclosed space means a greater risk to contract the virus, why is there even a discussion on reopening our schools?
That's a good question. I think one of the toughest things that's happening now for our kids, right, is when do they go back to new normal? One of the things about schools is that parents are going to have the choice. Parents will have the choice if they want full virtual for their kids, if they want a hybrid approach, or they unfortunately don't have the means to keep the kids at home. And I think that is, there has to be a safe way for those parents to have their kids at school somewhere in a safe manner. Because think about it, we live in an area of the nation. It's a very working class area where the vast majority of residents don't have that type of reserve to be paying for childcare, for private tutors, for this and that, to keep their kids at home. And some people work 2 jobs to make ends meet. And I think that is, we got to be sympathetic and also see if there's a way to do it in a safe manner. So I mean, ultimately, it's parental choice for the vast majority, for a lot of people in our society are going to have that choice, full virtual, full. But there are people that won't have that choice because their professions don't. And I think that we have to work with people overall. And I know that's going to be very difficult because there are a lot of professions that you cannot telecommute. Thank God that there's a lot of professions you can. People are going to have that choice, but there are a lot, especially in Miami-Dade County, is a tourist area, is a service industry, a local service use, it's a service geared toward our economy is very service oriented. People aren't going to have that choice. So that is a very tough discussion to have, and I know the superintendent has been working on a game plan for that. I know other schools have, because we have to work with those folks that need to work.
And again, that goes back to the root of why your cooperation is so sorely needed in trying to help stop the spread of this virus. As long as we continue to follow these guidelines, hopefully, again, we can go to a return to the phase where we were, and hopefully even improve upon that, to be able to have less restrictions and hopefully make a safer environment with less people spreading this virus, so decisions can be more easily made, especially when we talk about our youth.
Yeah, we have to do everything. I mean, one thing that doesn't get talked about kids, and I talked about it the other day on social media, is the mental health pandemic specifically for kids. I mean, you can only imagine, put yourself in their shoes. I mean, you got no summer. Your summer's pretty much, you're not hanging out at Venetian Pool. Remember when we were kids, do field trips out there, or Bucky Dent, or Bucky Dent Pool, wherever it was at. We would all, now you literally, you can't.
And your friends, your social impacts, and things like that. Absolutely, for the youth, this is a big impact as well.
Those kids that aren't having that summer, now the school year, you're gonna have to wear a mask even school starts, this and that. It's very difficult, specifically on kids. You know, we definitely got to think about them a little bit more, have more of a robust conversation around kids. You know, and what they're going through on their mental health side, and on their. We think about it. Yeah, we can talk through Zoom. They can talk to their friends through PS4 or whatever they're playing, but that's a short period of time. Long term, that just doesn't work. You know, you need that social interaction, specifically in your formative years. As you grow as a human being and you grow to an adult, you need that interaction to gain so important social skills to be successful in our society. I mean, that's just a reality. Any other questions, comments, concerns? YouTube, Twitter, Facebook.
We have a follow-up question from John Cuartas. He wants to specifically understand. 2 months ago, it was to flatten the curve. What is the goal for this closure?
So what I've gauged, and Tony, you can jump in, what I've gauged for the county mayor more than anything is to make sure that our hospital system is, they are still, our hospital system doesn't get overwhelmed like what happened in New York, right? We don't want to see what happened in New York happen here overall. Our hospital system still functioning, is still moving. But we want to make sure that this doesn't happen. What the county mayor did say, when these rules get implemented, it takes about 2 weeks, about 14 days to see the results to see if it's working or not. So, but I think the main goal was that to make sure that our healthcare system overall doesn't get overwhelmed. I mean, I don't know if that's
and that's absolutely one of the main predominant reasons for it. And also, again, is to help control. Every effort to control the continued spread of the virus. So, in turn, we help our hospital system be able to manage this effectively.
Yeah, and I think it's very difficult. But when you look at the stats and the data, and you look at the ICU data, yeah, is there some capacity left in our hospitals? Yes, but again, we don't want to get to what happened in New York. Specifically what happened in New York that was very difficult, and it was devastating, and and I feel for a lot of the folks up there. That was a very tough time that they went through in New York. Anything else, Claricel? Twitter, Facebook, YouTube?
We have a couple of questions on testing locations within the town of Miami Lakes. Do we have any?
Within the town of Miami Lakes, I hope to, personally, I hope to see pharmacies start doing the COVID testing. I do know that the governor had loosened those rules several weeks back, and I would love to see all of our CVS's, all our independent pharmacies here in our community begin doing testing. I believe that there's probably some small doctors, but I do know that the urgent cares, Baptist Urgent Care, I believe, is doing testing. Miami Children's Urgent Care is doing testing. So those two urgent cares in our community are doing testing. Do you have any other sites that are doing testing?
Yeah, and that's something that, we have a current discussion on is how can we increase the availability for our residents to have the opportunity to get tested. And that's an ongoing conversation that we're currently having. Also, it's something that we'll be more than happy to just post on our social media, or you can go to our coronavirus page on our website, or COVID-19 page on our website, to get a full scale of some of the testing sites that are near our vicinity. The largest county site that is nearby is at Amelia Earhart Park in the city of Miami.
And I think one of these conversations I've had with staff is that I want to see, hopefully through the pharmacies, hopefully something we can do, the deployment of rapid testing. I think what's happening now, these tests that take up to a week to get the results. I mean, the anxiety that folks are going through. You don't know, what's going on, or you don't know who, what you got to do. But I think the importance of the deployment of working with the federal government, with our partners in the federal government, to continue deploying rapid testing is so important. I think rapid testing is where it's at. I think you're seeing it now. A good example of that you're seeing it now in the bubble, right? The bubble in Orlando, the NBA. The NBA is restarting their season. You're starting to see a lot of rapid testing happening there. Before games, before this, the constant testing to make sure that it doesn't spread within the bubble, and have certain rules. So I think if we can deploy something similar in terms of testing here locally, I think it would really help keep cases down. It would really help contact tracers, and it would really help overall. I mean, I think it's so important to deploy rapid testing. While the tests today are great, but they're taking a little too long, in my opinion.
We have one last question. Are we still under curfew?
So countywide curfew at 10 o'clock?
10 p.m.
10 p.m. Countywide curfew, 10 p.m. The other night we had movies in the parking lot. I don't know if you guys heard about that, but our Youth Activities Task Force, their chair, Tony Fernandez, and our incredible staff converted our Movies in the Park series, which you all loved, on East 2nd Avenue on Montrose, and converted that to a pop-up drive-in movie theater at Anna G. Mendez University. It was phenomenal. It was great. But what was interesting was the start time had to shift, because we wanted to make sure we got everybody out of there before the curfew. So we did get out of there in time. The county mayor has put that in place, and I know his part of his reasoning is to make sure that there are less and less people partying, which that was something that I guess that a lot of folks were saying was causing some of the increases. But yeah, the county mayor, not the town of Miami Lakes, but we have to abide by the county. The county covers the all municipal areas and non-incorporated areas. So every city in the entire unincorporated area is under that order that is 10 p.m. We didn't have a say in that. We have to abide by it because there's an emergency order in place by the county, and it supersedes municipal home rule powers at this moment.
No further questions.
All right, thank you, Miami Lakers. Seeing no further questions, thank you guys for tuning in. Tony, anything else? Any closing remarks?
I just want to thank all of you for tuning in, and great questions that you posed today.
Keep sending in those questions. If you got any questions, any doubts, even on the legal side, we've had businesses where they don't know exactly what to do. Our legal department, our staff, we'll show you what our opinion is and what the information is, and we've helped a lot of businesses go through that process. So any doubts that you guys might have, any questions, we're here to help, you know, from the entire council, our staff, our volunteers. You know, they're doing everything they can to make sure that we get past this as fast as possible. Keep doing your part. I know we've all sacrificed a lot, especially during that entire shutdown at first. But let's make sure that doesn't go any further, and let's make sure that we keep wearing our mask. Keep wearing your mask